This is how low down your doctor is. Dr. Lowdown tells us that there is no good evidence that patients with macular degeneration will benefit from Acu or herbs. That's Dr. Lowdown's conclusion after considering these observations. Improved clinical efficacy, improved visual acuity, and swelling and inflammation of the macula. Dr. Lowdown explains that there were quality concerns. The people being treated knew they were being treated, and the people who were not being treated knew they were not being treated. So we can't scientifically conclude anything. Look away. Nothing to see here. Look away. Dr. Lowdown even acknowledged there is no effective treatment for macular degeneration. Anti-VEGF therapy, the current first-line treatment, may reduce the odds of legal blindness. All my patients got worse, but the ones that took this medicine were less worse. It's a miracle and worth billions. And acknowledge that clinical studies have confirmed that Acu and herbs decrease serum VEGF levels. It's actually a better result, but not profitable. But the report to the patients they serve says, nothing to see here. No interest or excitement in giving 20 million people in the US alone some hope and some relief. These low-down doctors suppress healing in exchange for profit. Low-down doctors keep you sick, keep your condition worsening, and keep you as a customer for life, even when they know. 9 times over, clinical trials have shown that Acu and herbs work, that you can improve this condition. You can get better, but they'd rather see this than that. Man, that's low down, doctors. They don't say that their rules make it impossible to be scientific. We're stuck trying to figure out how to touch somebody without them knowing so they can decide if something is scientific or not. But you and I both know that is an excuse, a rationalization, a story they tell to validate the harm that they are causing. Rationalizing hurt or control is toxic masculinity. And Jesus, there was nothing more toxic than, if you take my prick, your life won't be as awful as I'm telling you it will be if you don't take my prick. Are they speaking for you? Is that true? That you don't want to know that this helps with draining inflammation from the eyes? Reproduced 9 times over in patients who have inflammation in their eyes. You don't want to know that until they figure out how to do this without the person knowing that you're doing this. Or would you rather hear and know what they observe from doing this, so you can decide for yourself whether it's worth giving it a try? Seems like it couldn't possibly hurt. Unless it works really well, it could hurt the bottom line of Big Pharma. Do you have an interest in Big Pharma becoming more powerful? When you do what your doctor tells you, you make really rich a-holes more rich. You contribute to more dots on the map. They've already found fish turning trans. Do you think that the toxicity that is turning fish has anything to do with the growing interest in being the other gender? I don't know. If that's not enough, when you listen to your doctor, well, his advice is bad for your health. And as a culture, it causes great harm. Please remind him that religion teaches us that we will be judged on our actions. And if there's any chance of that, I would seriously not want to be one of the people who slandered God's medicine and killed nearly as many people as cancer with their man-made medicine. I think the Bible specifically frowns on killing. It's so weird that your doctors do it so often. You know that's not normal or okay, right?